Okay, so looking at some common issues with the knee joint region, we know that this joint has high stability requirements. We do not need our knees to be mobile. We want our knees to be nice and stable. They primarily move in just flexion and extension. They can do a little bit of internal and external rotation, but we don't want a lot of crazy movement happening at the knees. And we know, like we've said before, that the knee is not a bad joint, it just has lousy neighbors. So oftentimes, limited mobility in the ankle or limited stability in the hip and pelvis can actually cause issues at the knees. So one common issue is called knee valgus, and this is where the knees sort of fall in towards the midline. This is often also referred to as knock knees. So you can probably imagine this, someone whose knees really bow in, either when they're just walking or running, or if they do try to drop into a squat or a lunge and their knees just fall in. So this can be related to a couple different issues. Overactive adductors relative to abductors. So that would mean that our adductor complex, our adductor magnus, longus, and brevis, our gracilis and pectineus possibly are overactive, too tight, trying to do too much, relative to the hip abductors, which would be the gluten med and the gluten min. So we know those really help to abduct and stabilize the pelvis. So if those are not strong enough, and then the muscles on the inside of the thighs are too strong, that's going to pull the knees in. We'll often also see this with an overactive vastus lateralis, that's the quadricep muscle on the lateral, the outside, relative to the vastus medialis, the quadricep muscle on the inside. So targeting those imbalances is going to be really important. So that means strengthening the hip abductors, those gluten med and min muscles, and strengthening the vastus medialis, which maybe just means angling your legs so you target it specifically when you're doing quadricep exercises, if this is an issue for you or a client. And then doing some release or stretching on the opposing muscles. So the adductors or the vastus lateralis might need a little more work in terms of like foam rolling or stretching, which we'll look at in our exercises for the week. And then further down the kinetic chain, we see issues with limited ankle range of motion. So for many people, we're limited in dorsiflexion, myself included. I've been working on this for years. So a limitation in dorsiflexion is just going to cause issues up the entire kinetic chain, where if you can't dorsiflex, you will try to drive that whole leg inwards or outwards to gain more movement elsewhere. So that can cause some of that knee valgus, or it can cause you to drive out and cause some movement compensation to the hip and low back. So we're going to want to improve ankle range of motion and maybe even foot or toe range of motion. And then this can also just happen from poor movement patterns. A lot of people just don't know how to squat or lunge appropriately, and so it's just kind of helping them groove or train that movement pattern when you are doing them, maybe by offloading weight, like using a TRX strap or holding onto a chair or bench while squatting, or squatting back onto a bench can help groove those proper movement patterns. And then another issue we commonly see with the knee region is lateral knee pain or IT band pain, iliotibial band. And again, that can come from some of those valgus knee patterns because of the weak hip musculature, or it can come from too much tension on that iliotibial band from a tight TFL muscle, tensor fascia latae, because we know that muscle inserts into the IT band, so that could be an area perfect for doing myofascial release. However, something to remember is you don't want to actually do myofascial release or foam rolling on the iliotibial band itself. That is a band of connective tissue, not a muscle, so it's not going to respond to rolling the same way that a muscle would, and that can actually just cause some more compression or pain. So we're going to look at all of these issues, this kind of lack of hip stability, lack of ankle mobility, and then imbalance in musculature in our exercises for the week.